All right, well, good evening. Welcome. So nice to have all of you here tonight, and thanks for taking time out of your schedules to join with us as we recognize and increase dry eye awareness in July for Dry Eye Awareness Month. So thank you for joining in tonight and looking forward to hopefully learning together. We're excited to be here tonight. Last year we did for Dry Eye Awareness Month a review of upcoming dry eye treatments and what's new out there. This time we thought we'd try something a little bit different and make it more of a patient-to-patient webinar opportunity. So we're excited to have a patient with us tonight. I'll introduce her soon as well. Hopefully it'll be a good experience though as we learn together. Feel free to write some questions down or ask them throughout, and we'll try to answer them as well as we continue throughout the lecture. Do you want to recognize it's great to have being a part of the team with Dr. Beth Frues at Center for Sight. As well, it's really awesome to have Dr. Brar. She was our resident 2 years ago. We're lucky enough to keep her on board. She's really done a great job, one of our dry eye specialists, and great to work with for sure. And then I'm really pleased to announce our new resident. So many of you may remember Dr. Shaw last year. He completed his residency. Our new resident this year is Dr. Leah Griffin. She's from St. Louis. So we're really excited to have Leah with us as well. She's already picked it up quickly, and she'll be a part of the dry eye care team with Dr. Brar and myself. And then I think an important part of this dry eye team is the fact that we work as a team. And you'll see many times throughout the clinic, Leslie and Aldana, I just feel they're integral to our care. And as far as from working up to triaging phone calls, helping with medications to procedures, really we couldn't do it without them. So we're grateful that they're part of the dry eye team as well. And then we do have a patient with us tonight. I'll introduce her in just a moment. Her name is Stacy. So we're glad to have her. She's a patient that we first saw about 1.5 years ago. And through this journey, we've been able to do some different treatments and procedures. So I'm excited to show you from the beginning to the end. And then most importantly, hear from you, Stacy, on things you'd like to share about your dry eye journey with as well. And then just for fun, I thought I'd also add another guest tonight, AI, artificial intelligence. So I'm going to ask artificial intelligence some questions about dry eyes. I'm curious to see what Stacy thinks about the answers from our co-pilot for ChatGPT. So hopefully together tonight we can, from different perspectives, learn a little more about dry eyes. Aldana and Stacy, are you still there?
Yes.
Yes, we are.
Okay. Unmuted you so you can speak if you need to.
Okay.
Okay, good. All right. So the first one is I asked AI, artificial intelligence, to tell me about dry eyes and some symptoms and how it affects the lifestyle. Stacey, I'd like to just hear your thoughts as we kind of go through the answers. So here's what I asked artificial intelligence. What are the main symptoms of dry eyes? And sent by this co-pilot. We know it can be uncomfortable, and there's several bothersome symptoms. And I think that's an important part to mention. It's not just one symptom. Sometimes some are more noticeable. There's several bothersome symptoms. Many times it talks about burning and stinging, feeling of irritation, almost feel like there's something in their eye, kind of gritty feeling from bite sensation. Closely related to that is their eyes are red due to this low-grade chronic inflammation. And that's mainly due to some tear film imbalance, which we'll talk about here in just a moment. Blurry vision, in addition to feeling scratchy and gritty, but also our vision fluctuates. So patients might say, yeah, my vision's clear, but after 10 or 15 minutes, I have to keep blinking. And if I keep blinking, then it's clear again, or it's clear at first, and the longer I read something, it gets blurry. So there's a lot of vision fluctuation. Not surprisingly, if our eyes are dry and the surface isn't smooth, it's like having little tiny scratches on our eyes. So our patients many times are real sensitive to light. It makes our eyes feel tired. In fact, I had a patient the other day who said that because her eyes are so dry, she can't step past 8 o'clock. She just has to go to bed early. Her eyes just feel so tired, they feel better closed. And part of our goals of treatment is to make it so she's more comfortable later at the end of the day and stay up later. And then also watery eyes. So this is sometimes not something we normally think of, kind of counterintuitive, but sometimes if our eyes are so dry, the body's response is to try to increase tears to treat the dryness, but they're just watery tears, more reflex tears. So they don't really treat the underlying dryness. Stacy, do any of those symptoms stand out? Or you remember it first started about 1.5 years ago? Anything that you seem to be bothered you the most?
Yes. I feel like the co-pilot did a very good job describing the sensations that I had with my dry eyes when they started. I
Yeah,
think the biggest thing for me was this having sand or grit in the eyes because it does feel like you have something in your eyes. And I think you're going to show some pictures later. It was very, I don't know, very like I was surprised to see what those staining pictures look like of my eyes because I was like, oh my gosh, no wonder they feel the way they do.
yeah, that's a good way to put it. And many times it's almost validating for the patient. They say, "My eyes feel like there's something in it," all day long, and then you take a picture like, "Oh, there is a scratchy
Yes.
surface."
I think I've had every one of these symptoms.
I think that's a good way to look at it, Stacey, because it's several bothersome symptoms, and some might be more noticeable at different times of the day or the year or the activity than other symptoms. But I think for you and a lot of the patients who are listening tonight can relate to some of these symptoms that we're having right here. So Copilot did pretty well on that one. Let's ask AI one more question, Stacey.
Okay.
So, so that's it, Stacey. How does dry eye syndrome affect a patient's lifestyle? So you're someone who's in the healthcare field, a sales rep. You work in dry, arid conditions in the hospital. So I'm curious to see how it described it as well. It can significantly impact a patient's daily life. Discomfort, as we mentioned, with irritation and burning, that gritty feeling. Fluctuating blurry vision. Have to use artificial tears regularly. Reduced productivity makes it decreases work efficiency and concentration. Their eyes can hinder outdoor activity, especially in windy environments. So not only is it hard to do the work, maybe they avoid going outside. They can't go see their grandson's soccer game, for example. Redness and discomfort. Their eyes are red, and that can be pretty bothersome. A big factor for some patients where my eyes are always red. I don't want to go out to dinner because someone asks if I've been crying or why they're so red. Do you have an infection? Sleep disturbances. I think this is a cycle. Either we have dry eyes, so it's hard to sleep, or because we don't have a complete restorative sleep, our eyes get more dry because we're awake more throughout the nighttime. And I said to seek professional advice. How'd Copilot do there, Stacy?
Really well. I don't know. Copilot. I don't maybe you should have just invited Copilot. They did great.
Well, it's who knows? Maybe that's the future. You won't need me anymore. You just need Copilot. Yeah.
Copilot. Yes. Yeah, I it affected my a lot of the aspects of my job because when my eyes were red, when you go into the hospital and somebody is caring for you, you don't want to look up at your caregiver and note, I mean, and for them to look at you and have bright red eyes, that was a drawback. I was afraid that I might have to change my job just because the environment I work in is so dry and I it just I couldn't I couldn't get very much relief while I was at work. I used drops in the beginning and it was a struggle. Um, I do have to wear sunglasses. Sometimes I am more sensitive to light than others. And um, I noticed that I move around a lot so that I can get to a position where I can see the screens that I need to see to do my job. So all of those things have come into play over this last year and a half for me.
Yeah. That's interesting. You talked about how you even thought in your mind you had to change careers. Here you are in a successful career, all these great opportunities, but you felt like because the drives was so severe that it'd be hard to sustain that.
Yes,
Yeah.
yes.
Interesting. Yeah, I think these are all factors, and you described it perfectly. Having red eyes and dry eyes, you have to change your work setting. There have to be a special accommodations for it. Well, I appreciate you sharing that. And how long would you say that you had these symptoms before we saw you?
I would say I think I saw you guys at the end of November, so I feel like I started end of August, September timeframe, and I um, was seeing my family ophthalmologist.
Yeah.
Um, oh, and they at first it started with I was using just some over the counter drops, but then I started to notice that I really felt like there was something in my eye, and I developed or I thought I scratched my cornea, but it was just I had a filament, and
Yeah.
every time I blinked, I could feel that. And so, she we tried some different kind of drops, and I really reacted poorly to things that had preservatives in them. Um, and so eventually, she sent me to see you guys just because of the problems I was having with the filaments. And that's kind of how I wound up
I think I have a
coming to
picture.
the dry eye clinic. Yeah.
Well, this itself, again, we really appreciate being on our webinar tonight, Stacy. And I'm just gonna, with your permission, as we talked about, share some pictures, and then
Sure.
feel free to jump in and chime in of what you were thinking, as I talked about these things, or the recommendations, the concerns you're having. I think a lot of things you've described already are very similar to what patients have felt as well. So I'm really excited to have you on board. Let me just give everyone an overview of what we're thinking as providers. And I kind of created a little image that I modified from a great article. This is from the dry eye workshop. And in general, for tears, for dry eye disease, it's two things we're looking for. Maybe we're trying to look for tear, what's a tear quality like? Or they call that EDE, evaporative dry eye. And or what's a tear quantity look like? They call it aqueous deficient dry eye. So basically for dry eyes, if we looked at a broad picture, we're trying to improve tear quality and tear quantity. Now there's another exposure part, there's another component to that, and that's just exposure. So maybe patients don't blink all the way when they're during the daytime from prolonged computer work or reading, or maybe they don't close their eyes all the way when they're sleeping. So that can be a component at any stage, but generally speaking, as providers, we try to look at what's the tear quality, what's the tear quantity. And that's kind of what the studies have found as well, that there's basically a continuum. So I'd say we found from studies that evaporative dry eye accounts for 80% or more of the dry eye condition. Another 20, 15% is more aqueous deficient. But there is this overlap where patients might have evaporative dry eye, low tear quality, or aqueous deficient dry eye, low tear quantity, with this overlap on this continuum. So sometimes one might be the main factor, but as time goes on, as the disease progresses, maybe there's an aqueous deficient component to it as well. I think that's important to know because sometimes we have to change our treatment a little bit or add to the treatment based on the stage of the disease. In general, though, dry disease is mainly evaporative in nature, but as I just mentioned, both characteristics as the disease progresses become evident. So we'll kind of show you some pictures of both those cases for that. And I have a good question here. The question is, I don't know what type of doctor to see for dry eye, an optician, ophthalmologist, or my glaucoma specialist. Well, great question. Interestingly, my interest is in glaucoma, but because I want to try to treat glaucoma better, I'm trying to learn more about dry eyes because a lot of glaucoma drops can cause dry eyes. So, so we're trying to find that balance for you. I would talk to your glaucoma specialist or ophthalmologist and see if they have any recommendations for a dry eye center in your area that specializes in dry eye care. Great question, thank you. So this is the generally speaking for dry eyes. If I were to make that expand out from that simple tier model, look at all these other factors that relate to dry eyes. So again, this red eye, but if we zoom out, it's due to maybe inflammation, it's due to poor tear quality or low tear quantity, but all these different factors as we go around this clock here, this wheel, from nerve damage from previous surgery or glaucoma drops, our gut health, environment factors, eye accessories like makeup, different surgeries, hormone imbalance. So it's the word we use to describe that is it's multifactorial. I mean, there's multiple factors that can cause ultimately the dry eyes, the red eyes that we talked about earlier. I like what the report said. So this dry eye workshop that I put is really a key source for dry eyes. They said it's complicated due to its multifactorial etiology. I mean, there's multiple factors causing this disease. And we try to find what's a major causative factor. So it's kind of like we're detectives with the patient and the provider. We put our brains together, look at the signs, and try to think of what's the main factor of all these different factors that we can kind of treat or prevent or minimize or remove to try to make it so the eyes aren't so dry. So we kind of approach it with that there. I like what Dr. Griffin said this morning as I was kind of going over the lectures and things I was talking about. She said very perfectly, each patient is different. And I think that's important to remember throughout our discussion tonight that each patient is different, that some patients might have dry eyes due to eye surgery, previous LASIK or retinal surgery. Some it's more due to hormone imbalance, or maybe there's been nerve damage or environmental factors. So each patient's different. I did tell Dr. Brar what I was talking about, and I think wisely because she understands how I can get a little nerdy on these um, on these lectures, so I don't nerd out too much. She said, "Let's just keep it light." So that's my goal tonight, just to show you some pictures and go from there. But I want you to kind of see some background what we're looking at for. So thank you, Dr. Barr, for that good counsel for us as well. So here is Stacy's baseline pictures. Looks like we do have a question there. And great question. And I'm thinking I might just answer these at the end. So I'm going to go back through those later on. Keep them coming, though. I appreciate that. So here's Stacy's baseline. This is called LipiView. And it's basically an X-ray or gland scan of our meibomian glands. And many of you have had that done. And just by participating tonight, we want to offer that for you courtesy the next time you come to the clinic. If you've had it done before, let's do it again. If you've never had it done, let's do it. We just want to do that because it's that important to see how many glands you have and how well they may be working. Aldana, what do you see here? Anything that, how would you look at the glands? How would you describe it to Stacy?
Mhm. Yeah, definitely very good scan. We can see nicely both lower lids. Mainly about 80% of the oils what we need on the surface come from the lower lids. So that's why we typically just look at the lower lids. And the healthy normal glands should look like a parallel columns or piano keys. And that's what they look like. So here the patient has a really good quantity or amount or population of glands. Now in this right eye, which is to our left, OD stands for the right, we're seeing just maybe a little bit of a change like in the central aspect, and a little bit of a blur towards the nasal aspect right there where you're showing the external fluid. That shows that, or that means that the glands are maybe a little blocked. They're not working 100% due to some inflammation in the lid. But again, overall, pretty good population, plenty of glands to work with. Good news.
Yeah, no, you described that perfectly. That's exactly what I would have thought as well. The timing was perfect for Stacy to come in. That we have Stacy has good quantity. Just to get those glands working better again. So that's one of the things that is in our mind with Aldana, myself, or Dr. Brar, Dr. Griffin. We're trying to think. Well, it looks like there might be an adaptive component, so there might be a tear quality component to this. So that's helpful as well. And I'll show you also how the lids look. So if we see this clinically for the gland scan, then we try to push on your eyelids a little bit as much as we can, so it's not too just uncomfortable. And we want to see, well, if the oils are coming out, how well do they come out and how clearly? And this is nasally, so this would be this area here. Not much oils there, but really good. Some better expression here. If I push hard enough, and Stacy, you may remember that, got some of the oils to come out, which is a good, the functions there. So this is kind of our baseline scan. Let me show you some pictures, and Stacey, I'd love to get your thoughts on kind of things you were thinking as you first saw it. So you remember one of the comments that Stacey talked about is she felt like there's something in her eye, and her eyes were really red, really gritty. Well, this is of her right eye and of her left eye. What I want you to see is these little green spots all along the surface. Up here is great, nice and smooth. As we go further down, this band of dryness all through here. That's the right eye, and this is the left eye. And Stacey, I think that's that filament you're talking about there.
Yeah.
Little piece of tissue just kept tugging. And then even more than that is this is the white part of the eye, so different view, but this is why your eye was so red, because of all the inflammation on the white part of your eye.
Yeah, I remember when I first saw that, I mean, it really validated what I was feeling. Like because sometimes you'd feel like, am I crazy? Because why are my eyes feeling this way? Besides the redness, they were a little bit puffy, but not a lot. So when I saw this, it like just, I'm like, okay, now, this is why they feel that way. Now, how do I make that go away? That
Yeah,
was probably my biggest thought when I saw those pictures.
I think that's our concern too. How do we make it go away? And to try to help that, we want you to get to feeling better and looking better. And I think importantly, this doesn't happen overnight. It's been there for a while. So it takes some time to stop the inflammation, push it back, and get it started healing. One important thing that I'll mention here is this sounds strange, but I think we mentioned before, all these dry spots, the eye is so sensitive, so it should feel pretty scratchy and gritty and burning, just like you talked about. Our concern is with Dr. Barr, Dr. Griffin, or Aldana or myself, when a patient comes in and they have all these dry spots and they don't feel anything. They feel like, no, my eyes feel fine, doesn't hurt, maybe have a vision a little blurry. We're concerned at that point for a condition called neurotrophic keratitis, where the nerves just aren't working 100%. So that's one thing we'll talk about later in the lecture of things we could do. But the good thing is Stacy came in early enough. The glands were all there. You said better, and he still had good nerve function. So that shows us that if we can get it, reduce the inflammation, give you better tear quality, better tear quantity, we can restore that for you. So this is baseline. I'll kind of do a summary here. With baseline, we talked about different options, and based on what we found for the scan, the gland expression, the inflammation, we recommend two things. One is some in-office therapy. First, we recommend some home therapy, and I'll ask Aldana to talk about that in just a moment. But in-office therapy includes some using light. So we use light to help decrease inflammation, increase circulation, heal the glands that are blocked, increase the oil expression. And he did a series of low-level light therapy sessions and intense pulse light therapy sessions. In addition to that, we did start you on some steroids. This is the type of thing that's covered by your insurance, but there's great steroids out there that your provider can talk about, because all these little spots, it's called keratitis or inflammation of the cornea. So we have to really control the inflammation, and that starts to help the patient feel better. It might not be 100%, but at least we don't have that inflammation there. Kind of like having an inflamed elbow. You just always feel it. Just anytime you move, same thing with your eyes. If there's inflammation, it's not very comfortable. It feels sore and achy. And then, although what home therapy do we usually recommend? What are some good things you'd recommend in addition to in-office therapy? In her case, starting a steroid.
And there's a nice triad, which you refer to always, Dr. Lifford, which includes heat compress, omega-3 supplements, and blinking exercises. And all of these are very effective, inexpensive, and in easy ways for the patients to do something on their own at home to help the glands function better. There's a variety of masks available over the counter, so whatever is easier for the patient, either a microwavable one or rechargeable one, sometimes increases the compliance because you don't have to go to the microwave and heat it up. We do encourage healthy lifestyle, eating plenty of foods rich in omega-3 fatty acids. If we're not getting enough of those, we can supplement with oral supplements over the counter, and being more mindful of taking blink breaks during the day, especially when we work on the computer for long hours.
Yeah, I think that's great. So being mindful of our environment, the hot compresses, eating healthy, staying active like that. Yeah, I think that's helpful. And I think that combined with the home therapy helps, with the in-office therapy helps a lot. Thank you. Let me pull this up here. Good. Yeah, so after the treatment, we got to see Stacy back a month later. And Stacy, I think you're feeling a little bit better, but not great. And that's normal. If you look at the baseline photos on the top row, down here to the bottom row, there's still a fair amount of dry spots. And it looks like this filament was coming back, sticking around. It's not as dense as before, but some improvement in the symptoms.
Yes.
Yeah, that pesky filament.
Oh, I know.
And this filament just to compromise the cornea, so it just kept tearing on you.
Yes.
On this point, though, we thought, let's go ahead and try to increase the home therapy, or keep doing the home therapy, keep up the in-office light therapy, the low-level light therapy, combined with intense pulse light therapy. But because of how dry it was. It wasn't completely healed in your right eye and left eye. You may recall we did a contact lens in the left eye and then a Procare lens in the right eye. So a little side note, a contact lens, and this isn't your eye, this is just an example of another patient had, a contact lens almost acts like a Band-Aid. So like a Band-Aid to help a wound heal, provides coverage, and it can help heal it up for you. I'll show you pictures in just a minute. You can also use a Procare lens, which is what we did for your right eye. And a Procare lens is an amniotic membrane that has these natural growth factors. These natural growth factors help promote healing. And I feel it does a really great, amazing job on the surface. So here's an example of another patient that we had. We did a Procare lens. Had the patient back about 4 or 5 days later and significant improvement. So both are good options from a bandaged contact lens for maybe 5 to 7 days and or a Procare lens for maybe 4 to 5 days can help heal the surface. And so that's what we did for you. Once we saw less inflammation, we did continue the home therapy, did some more light therapy. Again, here's the baseline. And after about 4 months, Stacy, we were making some progress there.
Yes. Much better there.
Yeah, it was much better. And even though it wasn't perfect, we're starting to see some improvement. There's less staining. I think that's just a little bit of oils that I expressed there, but less staining. I think your vision is more comfortable and more stable. And importantly, as I pushed on the glands, the oils came out better. So look up here and before, not much expression, but because of all your home therapy, Stacy, in-office light therapy, intense pulse light therapy, low-level light therapy, we started getting the oils to come out. Maybe a little turbid, but much easier, better expression. Stacy, how did all this work with your lifestyle? Because you're busy with your profession, your career, and then I'm saying, well, do this at home and this, that, and I come back to do these tests and these procedures. What was going through your brain?
How am I going to do this?
Right, right.
Yeah. I was the drops, I was using multiple drops multiple times a day, at the hospital, which, I adapted to that. That was fine. The heat mask at home and all that was very soothing and that was very helpful. So in the beginning, I was doing that twice a day to try to help get things going. The bandage contact lens that I wore in my eye was fantastic. I couldn't feel the filament.
Yeah.
Because I think we tried that first before we did the Procare lens on both eyes, and that was helpful. But when it came to wearing the Procare lens, I was very nervous about that, just because it does, it had, because of the plastic ring. But when I wore it, you could feel it was there. But the benefit that I got from that, if I ever needed to wear one again, hands down, I would say yes right away. I wouldn't be so
Knock on wood right now.
afraid of it.
I'm knocking on wood right now. Hopefully you won't ever need another one.
Yeah, me too. Hoping not, but it was well worth it was well worth the 5 days that I wore it.
Good. It is a lot, and I think with working with Aldana, many times she's helping scribe with me. We'll talk about the different things we see. Our goal is to go at your pace for the patient. Each person is different, but at the same time, we'll give you like a little your tailored home care plan of things that we think would be helpful to do. Anything's better than nothing. It's a lot to do, especially if you're working or have family responsibilities. It's hard to do that, but yeah, anything's better than nothing. And then just kind of head in the right direction. Eventually, it does get better, but it is a lot, Stacy. And I think what you described is a lot of times how patients feel. We try not to overwhelm them with all these things we're seeing, but we try to let them know there's good options out there for them. I guess we kind of like going to take your car in to get the brakes fixed, but then your mechanic comes down and says, we need this fix and this fix and this fix. It can be a lot.
Yes.
But we do what we can based on what's most important at that time. So we're about 4 months out. So I think I saw you in the fall or early winter, like around November time. This has put us around springtime. I mention that because things actually got better. So about 6 months later, around springtime, things are looking pretty good. The surface was almost all healed up. Again, this is the baseline up here. This is about 6 months later. Pretty much healed up surface, just a few little spots of dryness. Oils are coming out really well, not as blocked as before. And then about a year later, so this is the following late fall, early winter,
Hmm.
got a little flare up. Isn't that interesting? That you were
Yes.
doing so well in the summer months, and as would expect, because the heater's on, the air is more dry,
Yes.
they dry out a little bit more. Was that discouraging?
Oh, very discouraging because I was still, I was taking my omega-3s. I was still using all my drops. And I'm like, why? Why was it? And it was just the environment. I think allergies could have played a little bit of a role with that. In just other inflammation that could be going on, I think aggravates it as well.
Yeah, good point. So here we are a year later, and where we thought we were making some progress, sometimes maybe the weather changes. This time, this one is winter time. We take a step back or two steps back, and I asked that question, Stacey, because it's easy for you to be doing everything right. You're doing all your home therapy, in-office therapy, the drops, and even with that, with dry eyes, which is so variable and unstable, sometimes we do take a few steps back. I mention that because it's important as a patient to not give up, to keep doing it. That eventually it gets a little bit better. It's something that's chronic and variable, as we'll mention later on, but there's still some good improvement. And what we're looking for is the overall gain. But this is about a year later, so this is a good time to see when it could get worse. I think what's helpful about this, Stacey, is also you became more aware of even environmental factors or seasonal changes or allergies, like you just talked about. Try
Mhm.
to be causing more dry eyes. What can trigger more inflammation? What can I do to minimize them or prevent them? So it's neat, Stacey, because you did a great job just being involved in your own care. Many times you had some ideas. In fact, I'll share one of your ideas later on. But this is really amazing what you were able to do with that. Any other thoughts, Stacey, before we try to turn the corner, and get you better again?
Um, no, no. I mean, I just, you just, I don't have anything to add right here for now.
Okay. Yeah. So I think you just described about a year later, is more flare ups. So now we'll go through the winter time. This will put us in early spring, and we start to get better again. So
Yeah.
I think the humidity changed. We did some things. I did put a plug in your lower lid, and these are just little silicone plugs that go in our natural tear ducts. These plugs ideally keep your good tears on your eyes longer, so it increases the tear lake. So hopefully you have more of your good tears to draw from. This is one of those steps we did for it. Once we saw there's maybe an aqueous component to it, it was fluctuating as well. That's 16 months later. And that was the last time I saw you. I think it's March of this year, March or April. And you're looking pretty good. I think we're going to see you back in a month or two. Hopefully, at that time, with everything you've still been doing and this time of the year, you'll still be looking pretty good. So we'll look at the gland quality and the tear quantity, the tear quality, the expressions. One thing that I thought was very important for what Stacey did, and goes back to what Aldana mentioned, is just being aware of our surrounding environment. You can have improved tear quantity, improved tear quality from the light therapy, your home therapy, but our environment makes a difference. And this is something from the lifestyle report. I'll give you the QR code for this later on. But if you look at it, think about our eyes, there's so many factors that surround it. So from the indoor setting, and this could be, Stacey, like you talked about in your hospital setting, or even in your car. As someone who travels a lot, I'll share that tip later on for you as well. So avoiding forced air, different allergens, gases, air conditioning, humidity levels. And then we go outside, and maybe that's when there's a lot of allergens outside, or there's a lot of smoke in the air from the forest fires we had a year ago, or different wind settings, or maybe higher altitude, windy settings like that as well. The sun, the sunlight level of humidity. So the environment makes a big difference. And many times we'll have patients who know that they're going to Arizona in a few weeks, and they'll pre-treat. They'll come in for low level light therapy, or they'll do the stare a little bit before and make sure they take moisture goggles to help with them, because they're aware of all these different factors that can, in addition to what could be causing some of the dryness, could make it worse. And with Aldana and I, and Dr. Brar, Dr. Griffin, it's really fun to learn from our patients what things you learn about dry eyes. And Stacy, we've told a lot of patients about this, but Stacy one day told us that she travels a lot for her job, and she said, "I found a car humidifier." I thought this was brilliant. Anyway, fits in your car cup holder, car humidifier, and it makes the air in the car less dry. So if Stacy's car is really her work setting, and she travels a lot, the heater's on. If she can make it so it's less humid, that's gonna make a big difference. It doesn't cost very much, but you can look online on Amazon for a car humidifier, and it takes it from dry, hot heat to more of a moist heat, kind of like in Florida compared to if you're in Arizona, for example, or a hot area. Related to that are moisture glasses. They're basically sunglasses. Cyclists might wear them, or more cyclists. But basically, they're just glasses. They come in different designs, and they have a nice foam seal on the inside that you may not be able to see. But that's a great thing to have. Let's say if you're going to Arizona a couple of weeks, for example, or Las Vegas, it's really hot, really dry. They may not be the coolest, but this is a good way to help protect your eyes and create your own moisture chamber. So as we plan ahead and look forward, think about the environment, those different roles, these are ways we can modify it. Or go to Florida in the wintertime. That takes care of it too. That helps with better humidity. And Stacey, we've told a lot of patients about this, so we appreciate your brilliant idea and sharing that with us.
Yeah, it did help. It did help, but in the wintertime especially, I don't need it in the summertime because Indiana is so humid. But in the wintertime, that was a game changer for me, especially when, I'd be driving somewhere 2 hours.
Mhm.
By the time I'd get there, I'd be miserable or trying to, this is terrible. I shouldn't tell on myself, but trying to put drops in my eyes while I'm driving.
Yeah, really.
But
So it's that dry.
oh
Mhm.
yeah, I mean, and I think maybe it was a combination of not blinking enough as I was driving, but there in the beginning, early on, I would just dread if I had to drive anywhere for a long distance
Wow.
because
Well,
my eyes would just feel like they would just feel like like my eyelids would stick to the outside of my eyeball. If that makes sense.
actually, you've described that perfectly. Yeah, and it's interesting that you even dread taking that long drive, which is part of your job. And I think you're right. That's a great point that you can be in a dry environment, but if we're doing things like prolonged driving or reading or work on the computer, we're really focusing, so we're not blinking as much. And then add that to it, and the dry force really drives them out. So unfortunately, you're in an imperfect setting, the imperfect storm of causing more of the dryness. Interesting. It's helpful for us to hear that. It's sad that you had to go through all that, um, just with your concerns with your career and driving and safety like that. I'm glad you figured out some ways that it's getting better for you. And this tip you gave us was so helpful. Well, let me just kind of review Stacy's journey. And as Dr. Griffin mentioned earlier, each patient's different. So we'll start in different ways, but she has some light therapy. We feel like this is a great way to help turn on the glands again, help them working better, increases function, increases circulation, decreases inflammation. And low level light therapy combined with intense pulse light therapy sure helps with that depending on the level of blockage. Sometimes patients may not have much inflammation. We'll just focus on low level light therapy. And it takes about 20 minutes to 25 minutes in the office to do these procedures. It's real relaxing, doesn't hurt, doesn't affect your vision. You get up and go. And done unless they're really great as far as scheduling for a time that's convenient for you so you can come in and get back to your other responsibilities with work or with family. We treated that to improve the tear quality. We also wanted to decrease inflammation. When there's inflammation on the eye, that decreases tear production. So that affects the tear quantity. So there's quality and quantity. We wanted to improve the tear quantity. The other way we improved the tear quantity was we put in a tear duct plug in your lower lid. We did a Procare lens in your right eye and bandage kind of lenses in both eyes. That's right, I forgot about that. We also started down a non-steroidal eye drop. Just to note, these steroids sure are helpful. They help control the inflammation, but if we take them too much for too long, especially if you have glaucoma, that could increase the risk of inflammation or increase your risk of higher eye pressure. So if you use a steroid, it just has to be for a few days or under the direction of your doctor. But there are other eye drops we can use that are immunomodulators. like Restasis or Cequa or Xiidra, and we put you on Xiidra as well to help decrease inflammation, control that inflammation. I think this is one that was covered by your insurance as well to help reduce inflammation. But each person is different depending on their insurance as well. This is something that's taken 2 times a day. It's not a steroid. It's safe to take. In addition, we did transition to Mibo, which helps with tear quality. It is steroid free, also. It's preservative free, and it's real oily. It's kind of like a tear stabilizer. It is a tear stabilizer. What it tries to do, it pairs with our natural oils down here from our eyelids and creates a more stable, protective environment. It decreases what we call tear breakup time. And it delays that evaporative component of dry eye. And then we also did at one point as well, later in that, some plugs in the top lids as well. So that way we're keeping all of your good tears on your eyes longer. And then also added Tyrvaya. This is a nasal spray which ideally helps increase tear production. It stimulates the trigeminal nerve, tells the brain here to produce tears there. A lot to do, Stacy. You did a lot, especially the front end.
Yes.
Our goal is to hopefully cut back on a lot of these things if we can, just find whatever needs to be done as simple as possible for maintenance.
Yeah, I would like to add something in regards to Stacy's journey. What really stood out for me, Stacy is our perfect challenging patient, challenging from maybe clinical standpoint, but perfect in a way of her compliance. So because with dry eye treatments, we can recommend so many different things. We can come up with drops and different treatments, but at the end of the day, if the patient does not comply and does not follow with all these different recommendations, which at the same time can be challenging and can be time consuming, or even expensive, but we wouldn't be able to really achieve anything. We wouldn't be able to get the patient feeling better, and that's our goal here. So I really admire Stacy's this determination and again the compliance with all these different things, because it's quite a bit as we're looking at this picture, and it can look a little overwhelming. But yeah, she was a great patient, very easy to work with, very easy to try new things, and well, she's feeling better, which is great.
Yes. No, I'm very thankful for you guys because you helped me so much.
It's been a pleasure.
Well, you've been great, and as Adana said, we mean that in the nicest way, that you've been a great patient to see this process for you, and we're glad that you're doing better. And I think that's important to kind of summarize some things here by way of review. Pull this up for us. With dry eye disease, it's a few things, as I think about to kind of summarize, it's very common. In fact, at least 38 million people in the US have dry eye disease. And I was looking at those numbers, and if I did my math correctly, that's take all the people of New York City, all the people of Chicago, all the people of LA, put them together. Those are diagnosed dry eye disease patients, at least 38 million. But they have studies that found that maybe there's 150 million people who have dry eye symptoms. So these are undiagnosed patients. So dry eye disease is very common. And I think a lot of times what happens is, Stacey, what you did, and what many times patients, we all do, is if they're dry, we just use artificial tears, and that usually works maybe for mild dry eyes. Sometimes though, it's just not enough, and then we seek care, or other times we just kind of think that's the way it is, and we get used to it. So the important thing is dry eye disease is common, and that's why this Dry Awareness Month is so important, and this webinar is important to recognize that it's out there, and there's things we can do to help you feel better. It's interesting and important to know that really we shouldn't feel our eyes, shouldn't be thinking about our eyes all the time. They should feel normal, nothing we should worry about. Kind of like having that stiff elbow. We shouldn't be feeling that elbow all the time if there's inflammation. So dry eye disease is common. It's chronic. I wish I could give you an example for Stacey. I'm sure Stacey would feel the same way, where we just gave her one drop and that took care of it overnight. But unfortunately, she had had it for a while, and you'll always have some sort of dry eye condition. But hopefully we can find a treatment that's sustainable and manageable, effective, tolerable for you. sometimes I'll tell patients it's kind of like having arthritis. You'll always have it, but if we can minimize the symptoms so they're not severe or significant, you're more functional, then that's our goal. The dry eye disease is common, it's chronic, it's multifactorial, meaning there's so many things that can cause it, so many factors. As we showed you on that wheel, from different health conditions or hormone changes, medications we take, injuries to our eyes, surgeries to our eyes, our environment, which plays a big role, our gland function, autoimmune conditions like arthritis or Sjogren's syndrome. So as providers, and with patients, we're detectives, combined detectives. We're trying to figure out what's causing this dry eyes, how can we treat it? And then that note I'd add about dry eyes is it's unstable. So Stacy was doing pretty well with initial treatment going in the spring and summer, and then around fall or winter time, we got some dry eyes again. And we try to prepare for that, try to anticipate it, but sometimes it still gets these flare-ups. The important thing is, like what Stacy said, is to just recognize it, not be discouraged, and that there's ways we can try to work around that so you can get feeling better. But also will say that not only is it all these things, it's manageable, it's treatable. And we can't, it's not curable, we can't cure it, but there are some things where we can make it so at least it's more tolerable and you can actually enjoy driving again. You don't have to worry about going to work because it hurts so bad. You can go outside to see your grandson play soccer where it's not so windy because you have some protective glasses on. So different ways we can treat and manage it. And I'd also add one other adjective, it's hopeful. I mean, there's a lot of good things that are always coming out all the time about dry eyes. This is a common condition, and I think, a lot of research on ways we can improve and treat it, not only in diagnosing dry eyes, but also in treatment. So as severe as it is, to stay with it and always be asking what's new, and ask your doctor and keep looking online. The more we know about it, the more we can address and treat it. Aldana and Stacy, any thoughts you want to have about this review before I show two more slides about things that are coming out that I think are important for us? Aldana, for you, and then I'll say the last words on that one.
No, I think you. Oh, I'm sorry, Stacey.
Go ahead. No, go ahead, Aldana.
No, I was just about to say this is a great review and great summary of really what dry eye disease is. But I would just add one thing to our patients. You don't have to suffer with dry eye. Sometimes patients say, well, that's just the way they feel, and that's how they're supposed to feel because they're just used to maybe a certain level of discomfort. It is definitely treatable. So you don't have to suffer. You don't have to feel miserable. You don't have to feel like this is just the way it's going to be for the rest of my life, because there is hope there. And just reaching out to even primary care providers, because they can refer their patients out to dry eye clinics, or having that conversation with primary care optometrists when we go just for a routine eye exam. And they may not have the ability to provide extensive treatment for dry eye, but they can refer that patient out to the clinic who does dry eye treatment. So overall, this is a really good summary, good review.
Aldana, that's great. And one thing about Aldana is her care is genuine. So she really feels that way. You don't have to suffer. That we're going to keep trying. As long as you keep trying, we're here for you regularly and consistently to help out with that. So thanks, Aldana, for saying that. Any comments you want to say about your journey you've had, the pictures, the summary?
I just wanted to add that, it's treatable. I was in the beginning, I was, I guess, disappointed that it was something that wasn't curable, but the fact that it's treatable and you know, it's just something that you learn to manage.
That's a good way to look at it. It's just changing the perspective a little bit, that we're going to try to manage it and treat it, and that we can still have a good quality of life going forward. Yeah. Thank you, Stacy, for adding that. Well, let me show you two other things here that I think are important. We kind of, by summary, we also talked about dry eyes as tear quality, tear quantity. We try to find which ones are both. If you have your phone, you can take a QR code. Remember I mentioned earlier, Dr. Brar suggested I try to keep it light. So this is my way of trying to keep it light without showing lots of graphs. This is the first one is a list of, this one shows the dry eye workshop recommended treatment steps. So if you go to table 4 of this website, that'll show it to you. That's kind of what we base our treatment on as well, which is always evolving and expanding. This one over here is the lifestyle report. Both of these are referenced down here as well. This has a good graph that talks about not only how dry eyes can affect our lifestyle, but how can our lifestyle affect dry eyes. So it's a good graph. It's figure number 1 in this one over here on the side, right here. So if you have that, you can scan that to with your phone, or the links are down below. And two things that are coming out that are important. One is we're learning more about Demodex blepharitis, and Demodex blepharitis is a type of mite, a mite that really loves our lashes, burrows into our lashes and our follicles, and it causes this byproduct, kind of oily, greasy color around the base of the lashes. The problem with that is it kind of affects the glands. See, I kind of lose these glands here, causes a lot of inflammation. We're finding that leads to meibomian gland dysfunction, so it affects the tear quality. It leads to styes and makes the eyelids really itchy right along there. In the past, we've done different treatments with lid wipes, with tea tree oil. IPL helps take care of a lot of that. But there's a new medicine out called Xdemvy, which works really well. You take this medicine 2 times a day for 6 weeks, and it kills all the mites. It's 2 full life cycles of these mites here. These mites are real common. We all have them, but sometimes in some patients, for whatever reason, they overpopulate. And when they overpopulate, it causes more inflammation and irritation. This takes care of that. This is a before picture for a patient. 6 weeks later, here's what it shows here, all cleaned off. Different cameras, so different exposure, but they were doing much better. Their eyelids weren't itching. The glands were looking better. So there's a nice treatment for that who have Demodex blepharitis. Stacy, this isn't something you had. Your lashes look great, but that's one thing we look for that as well. Xdemvy for Demodex blepharitis. The other final thing I'll show you is talk about how Stacy, when she came in, her eyes were really dry. And it sounds strange for us as providers to say, well, it's good that you feel these symptoms. That tells us as providers that there's still good nerve function. Sometimes a patient might have dry eyes for so long that the nerves just kind of turn off. So Stacy, if you would have waited maybe another 4 months or 6 months, maybe longer or less than that, maybe the nerves would have turned off. It wouldn't have felt as gritty, but it would have kept getting more and more dry because the nerve function was turned off. And we need those nerves to help stimulate the epithelial, the surface healing. So we're learning more about corneal sensitivity testing. So when you come in for your clinical exam, at some point, either baseline exam or soon thereafter, we'll just take a Q-tip, make a fine tip on the end, or a piece of dental floss, and just touch the cornea. We want to see if we touch it here. Do you have the normal blink reflex? Or down here, do you have the normal blink reflex? If there is decreased sensitivity or if it's absent, and we're finding in the earlier stages it's good to use it, there's a treatment for that. It's called Oxervate. We found with Oxervate, once it heals the nerves and the nerves turn on again, we have healing that lasts. So it's more sustainable. So 2 good treatments that we're applying more in the clinic as well. Now, as part of the you attending the webinar, and to thank you for your time, if you haven't received a meibography yet, next time you come in, let's do it. It's complimentary, of course, called as gland scan. So you don't have to whisper the code or anything. Just tell Adana you were at the webinar or Leslie, and we can do that meibography. And then also, the final one is for those who have attended, we wanted to offer 3 patients to have a complimentary light therapy session. Stacy, her alone, just by taking her time today, gets a complimentary one, a courtesy one. You can all give Stacy a round of applause or clapping for her participation. We really appreciate it, Stacy. It's just made it that much more special, that much more personal. So we couldn't have done without you. So thank you for being on board, letting us use your pictures and your comments. So
Thank you, Stacy.
Oh, you're welcome. I tell everybody about you guys.
Well,
because they all got to they everybody that I work with, watched my eyes get better. So
good.
That's so rewarding. That's great. That's great. Yeah.
Well, let's go through the list. Leah Griffin, I'm not sure if you had a chance to do a random generator. I'll let you turn on here. Let's see.
I wasn't able to see the cat on the
Either.
people on the Zoom call.
I
Okay.
couldn't see it either.
Okay. I have it right here. That is Dr. Brar, who you just heard, and Dr. Griffin. Dr. Brar and Griffin, will I select some names here randomly? What comments do you have? Any other thoughts you have about this condition, the treatment, your approach, your concerns?
I think everything yeah, looked great. I was just really pleased to I didn't see Stacy from the beginning, but I think I saw her a couple of times, and just, through seeing her progress and journey, I'm just amazed, and I'm really, really happy for her.
Good.
thank you.
Dr. Brar, I put it at the beginning of the lecture. I'm not sure if you saw, but you told me to go light so I don't get too nerdy, and that was my goal tonight. So
Oh, perfect. I'm sorry, I wasn't able to I was unmuted for a really long time.
that's okay. That's good. Dr. Griffin, any comments?
I think just starting in the dry eye clinic and seeing how multifactorial and every patient is different, every stage is different, every treatment option is different, kind of helps us give that individualized approach and just kind of like trying to motivate the patient through their process of, the dry eye treatment and, feeling better really helps.
Yeah, I like that approach. And I quoted you earlier as well, Dr. Griffin, that each patient is different. Each patient matters there. So we kind of take that approach differently. Aldana, I'm going to read off some names here. Do you mind just kind of writing them down? And I know we have some attendees who might not be local. If you're not local and you want to come, we're happy to do this light therapy. If not, we can pass on to the next one. But first one is Lori Miller.
Just a second, Dr. Levert.
Yeah.
I got it.
Another one is Jane Slattery. And Sylvia McTire. So those are our three winners of the complimentary courtesy low-level light therapy session. You can come
Okay.
and let Aldana know or Leslie know. When you come in, let's also do that LipiView scan as well for that. So we have some good questions here. Let me kind of pull those up. I appreciate everyone coming in. I know I'll catch you a little bit longer, but if you have some time, we'll just go through these questions. We talked about patient asked, who should I see for dry eye? Optician, ophthalmologist, or my glaucoma specialist? I would check with your ophthalmologist or glaucoma specialist and see who they'd recommend working with. Of course, a dry eye clinic, and start with that. And then good question asked, is there association between dry eye disease and dysautonomia? And I think there might be something there. That's a great question. Dysautonomia just means the nerves don't work as well. So that normal nerve function that sets our autonomic nervous system isn't working as well. There's some dysregulation. And if we're always in a excited state or a less excited state, I'm sure that affects the tear production, our blink rate. So great question. I'm not sure if there's any studies about that, but I would think that would be connected. I'll have to look into that more, and we're learning more about it. So great question. That's one of those systemic conditions as well, like other autoimmune conditions such as arthritis or Sjogren's syndrome. Maybe that's something else that can relate to it with the nerve function. We're learning that nerve function plays a role in our corneal surface rehealing, but there's abnormal nerve function or regulation, it could affect it. Question asked about prescribing effectiveness of estradiol. If I have an experience with that, that's a great question as well. I don't. We know that hormone imbalance can cause dry eyes. And there have been some of my patients who have already started some hormone therapy by their functional medicine doctor, or they've done some hormone blood work, and they're finding improvement with it. So that's something that I haven't gotten into directly, but we've worked with like their family doctor or the functional medicine doctor or their OBGYN to work with it. But I think there's a role in that. I do know there's a role in estradiol and estrogen as far as glaucoma development as well. So I think that's one of those protective hormones. It does make sense because unfortunately, dry eyes is disproportionate women more than men. I mean, those estrogen levels, I I feel like they are playing a role in that. Dr. Brar or Dr. Griffin, any comments about those? Or if you're fact checking me, any comments about that?
No, I think you said it really well there. I think just um the hormone imbalances just over time, um, just even monthly hormone changes that women have, can kind of make your eyes feel differently. Definitely being, even pregnancy, breastfeeding, there's so many different changes. I was recently pregnant and I felt like my eyes were really dry, so it definitely has a big factor on, your eyes, just the hormone changes. So I definitely agree with everything you said.
Yeah, so I think we're gonna learn more about that as the importance of hormone balance, and maybe that's something we should look into, Dr. Brar.
Oh,
Um,
definitely.
a workup as far as some blood work. But you're right, maybe just the monthly menstrual cycle to be aware for patients to plan on using stairs a little bit more around that time or using tears more often that time. It's a great idea.
Yeah.
Paula, it's a question that what if you're doing everything right, the home care is successful, and then one morning there's severe pain on awakening, apparently secondary to significant abrasion erosion. What changes? What caused that? Dr. Brar, you want to get that, or Dr. Griffin? So the patient's doing really well, and then one morning they wake up and they have this really severe pain.
Yeah, sure, I can get that. Or Dr. Griffin. The patient, sometimes overnight what can happen in certain eye conditions, certain corneal dystrophies, the cornea naturally swells up in everybody at night, and you get a little bit of additional swelling, which is very normal. But in certain patients, just there's a little bit more swelling, maybe just because of a irregular corneal surface, and that can create some, friction when you open your eyes, making the area a little bit more dry on the surface. You open your eyes, and all of a sudden, it's really painful. So that can be a sign of, a corneal erosion or something, getting a lot of friction from the eyelid and corneal interface that. And those are, situations where definitely calling your doctor in the morning is beneficial just to get it treated the best we can, the quickest possible, to relieve that pain because it can be quite a painful situation there.
The hard way to wake up when you have a scratch in your eye.
Right, exactly. I mean, I've not had one yet. Hopefully, I don't get one, but I've heard it's very painful. So having that treated as soon as possible will be the best course of action. And, it definitely heals quickly without any problems that most times.
Yeah. I think that's a good way to describe it. And this is one of those cases where patient might have good tear quantity, good tear quality, but maybe there's an exposure component for whatever reason, corneal swelling, your eyelids open up, or your pillow open up your eyelid a little bit, and cause that exposure component, and that caused the dryness. So it's tough, and that's one of those for a multifactorial disease. We have to have a multifactorial approach. I look around there. Our own Dr. Griffin asked a great question. What words of encouragement do you recommend for those patients who battle with chronic dry symptoms and feel like they've exhausted their options with treatment? I'm actually going to ask Aldana that question. Aldana, if a patient feels like they've done everything they can, tried all the options, what would you tell them? What words of encouragement?
Well, for sure, I would say don't give up, and keep trying, keep working. Um, there are always options there. I mean, even the worst case scenario, if we run out of options, there's other doctors we can collaborate with. So there's always hope. But the interesting part is sometimes when I hear that, sometimes I tell patients we have to look beyond their eyes, and what I mean by that, um, treating the eyes themselves, it may not be enough in order to address the problem, because in those really, really severe cases, very often there is a systemic component, or as we mentioned before, hormonal or autoimmune component. That could be even a psychological component, or nerve pain component. So seeking help from other physicians and co-managing the dry eye with them is important too. So yeah, just don't give up. Keep trying. Keep up the good work. And there's always good things we can do. So the options are there. It is challenging. It can be frustrating and really exhausting, but there is hope.
That's perfect. I can't add to that. Well said. Thanks, LaDonna. Two other questions. Do protective goggles work with prescription glasses? And they do. They can. So I think if you're interested in doing that, there are some websites that can actually make glasses with your prescription in it, and they have a seal around those glasses. So those are available. Maybe you could just search online prescription glasses with seal around them, for example. Or there's some that even go over your regular glasses as well. Admittedly, I know they're not the coolest, but maybe if you're just around your home and no one's around, that's one extra layer of protection. Or maybe you're driving like Stacy was talking about, and that might be a way just to protect your eyes a little bit more. Whatever you can do, anything is better than nothing in settings like that. So if you can protect your eyes and minimize forced air, it sure is a good option. So there are sources available for that. You just have to Google it. And then the final question is, why isn't Lacrocert available? Great question. I think Bausch and Lomb may have acquired it, but I'm not sure why there's a delay in bring it to market. Lacrocert was available maybe 10 or 15 years ago at least, as a little pellet that the patient would use a little device, pull it on their lid, and put it in the bottom of their eyelid. And this pellet slowly released this gel-like fluid, carboxycellulose or something similar to that, and it lasted all day long. It was a great option. Hopefully, it will become available. Like I said, dry eyes, it's hopeful. There's always things come out. Hopefully, they'll be able to bring that to market again. So I'm not sure about that, why the reason, but I hope it will. It's a great way to do it. Good. And I think that ends our questions. Unless there aren't any other questions, we want to thank you. Thanks for joining tonight, spending time with us as we recognize and celebrate, if that's the right word, for Dry Eye Awareness Month, as we all learn more about dry eyes and learn together. I want to thank especially Stacy for coming on and sharing her story and letting us learn from her as well. And big thank you to Aldana, one of our awesome team members, Dr. Brar and Dr. Griffin for helping us out. It really is a team approach, and I'm lucky to be able to work with people like that and to help with patients like you. So thanks again for joining tonight. Have a great night. Thank you.
But I know those things are not good.
Thank you.
Thank you. If you have any questions, feel free to email us at those email addresses. Thank you. Thank you, Stacy. You did such a great job. I really appreciate all your help.
Thank you. Thank you, Dr. Lifford. I was happy to help.
Well, what you said was perfect. It sure is a good way to learn, and it's nice to hear from someone who's gone through that journey and the struggles and concerns and successes and everything else. So it was perfect. We're glad you came on board. Thank you.
Okay, well, thank you. Have a great evening.
Yeah, you too. Appreciate it.